around New Jersey, around the clock. This is News 12, New Jersey.
Welcome to 12 to Your Health. I'm Dr. Derek De Silva. The recent death of actor Robin Williams is bringing the issue of depression and suicide back into the spotlight. Would you be able to recognize the warning signs in your loved ones or even yourself? Joining us today is Dr. Gabe Kaplan. He's the Medical Director of Behavioral Health Services at Bergen Regional Medical Center. Dr. Kaplan, welcome back to the program.
Thank you for having me.
Thank you for joining us. So, what are some of the warning signs of depression?
Well, it's very important to understand that depression is a medical illness and not a weakness of spirit. So this is a medical problem, and as such, there are some warning signs. People start feeling different. They're getting tired, they can't sleep well, they can't get through their day, they may increase weight, they might decrease weight, they might feel agitated, and they start really not feeling well, even having pain, symptoms of unexplained origin. And so when you have that and then you're stuck in this sad mood for a long time, not just feeling sad one day, but when you're stuck with the mood, that speaks of warning signs of depression.
And what about warning signs of suicide?
Well, unfortunately, one of the complications of depression, as many other psychiatric illnesses, is suicide. And in these cases, people feel so awfully depressed, so demoralized, that they start thinking about life not being worth living. And the important thing is that about 3/4 of people do actually talk about this to other people. They communicate. So they start saying things like, I wish I were not alive, I wish God would take me, I can't really deal with life. And then more serious signs are they start giving things away out of the blue. Here's my collection of this, here's my collection of that. And a very lethal combination is that type of feeling, alcohol in the house, and weapons in the house. Very serious, very high predictor of suicide.
So if somebody says, I wish I weren't here, you know, I wish I were dead, how seriously do we need to treat that?
We need to treat that very, very seriously in the context of who says it. I'm not really out joking with friends, but in a conversation with a friend, they start telling you about this. It's very important that you communicate to your friend, to your relative, I think maybe we should go seek some help. I'm really concerned about you.
Right. What's the lesson that we learn from Robin Williams' death? You know, this is a very beloved individual to all of us. What's the takeaway lesson from this?
The takeaway, I think, is that suicide is a medical problem. We're not immune. Anybody can have that problem. And it's very important. If there's one thing that this did is to bring the topic to the forefront. We're all grieving about Robin Williams, and he had been the champion of many, many causes. Us talking about how to prevent it, how to get the care to people that need it, I think it's a very good thing.
Thanks so much for joining us. Really appreciate the great information once again.
Thank you.
And here's what we're working on for next week, and remember, you can